Hello there, is it John Johnson?
It is, yes.
Hi, my name's Dr. Biffin.
Hello.
Nice to meet you.
Thank you very much.
How can I help, sir?
Well, I've come for the results of the test I had, was it called ECG?
ECG, yeah.
Heart tracing, that was
Yeah.
it? Yes. Yeah, that was 10 days ago, so I've come for the results of that.
Okay. So, can you tell me a bit about why we did that test?
Well, I have blood pressure issues, as you probably know, in your system. And when I was here recently having my blood pressure taken, the nurse felt my pulse and said that it was quite irregular.
Mm-hmm.
And in the recent past, I've been feeling sort of unnaturally tired, for no reason, very strange, particularly if I'm gardening and whatnot. So I realised something was up. I mean, I'm not a young man anymore, as you know, but I felt something was wrong. So the nurse said, your pulse is irregular and we're going to get checked out, and I had the heart tracing.
Okay. So, I understand you've been feeling a bit more tired recently.
Yes.
Have you had any other symptoms at all?
Well, no. I mean, I do get tired now. I'm older anyway. But it's a kind of natural tiredness. It's weird, really.
Okay.
It comes on, I'm doing things. Otherwise, not too bad,
Okay. And you haven't had any, so is it alright if I ask you a few more direct questions
Yes, of
about
course,
any symptoms
yes,
you
yes.
may or may not have had?
Yes.
Have you ever felt your heart beating quickly in your chest?
I haven't felt anything, no. Not at all, no.
Okay.
No.
And obviously on our records we know that you've got high blood pressure
Yes.
and you're on treatment for that.
Yes.
Have you ever had a heart attack in the past?
No.
No.
Is that what they're worried about then?
No, that's not what they're worried
Oh, I'm
about.
sorry then. No.
It's just part of some questions that are relevant to the ECG and what we found out.
Yes.
Have you ever had a stroke before?
No.
A mini stroke?
No.
Do you suffer with any chest pain?
No.
Okay. And do you ever feel dizzy?
I don't know. Don't think so, particularly. No.
Okay. That's good.
No. This is tiredness, really. Yeah.
Okay. And that's been going on for a while.
Yes. I've not thought about it really.
Is there anything that's worrying you about that?
Well, obviously I know to know an irregular pulse sounds a bit serious, isn't it, really?
Okay.
You mentioned heart attack, so...
Do you want me to explain what the
Yeah.
results are to you
Yeah,
now?
I mean, I'm not bad for 82, really. I'm not bad at all, but,
Okay. So what the ECG shows, as you said, we did it because you've got an irregular pulse.
yes.
And what it shows is something called atrial fibrillation. Now I know that's a big word, and I'm going to explain to you now what that means, if that's all right.
Yes.
Okay. So what it means is it's quite common.
Yes.
That's the first thing to say.
Yes.
And you're more likely to get it if you've had high blood pressure or something like that in the past.
Right, which I have.
Now the heart has, I don't know if you've done any anatomy before in your life, but the
Not
heart
particularly.
has 4 chambers.
Right.
Okay?
Yes.
The ones at the top, that's not a very good drawing.
That's the top.
The ones at the top
Mm-hmm.
are called the atria,
Yes.
and the ones at the bottom are the bigger ones, the bigger compartments that send all the blood around the body.
Right.
Now in atrial fibrillation, what normally happens with the heart is this muscle here squeezes the
Right.
blood from the top
Yes.
into the bottom,
Yes.
and then this muscle squeezes the blood around the rest of the heart,
Right.
around the rest of the body like that.
It's a pump, basically.
It's a pump, exactly. That's a good word. So what happens in atrial fibrillation, instead of this muscle squeezing nice and regularly with
Yes.
every beat,
Yes.
what happens is it goes a little bit like this.
All right.
So that's what the word fibrillates is.
Okay.
So it's not beating normally as it
Right.
should.
I'm quivering.
That's it.
Yeah. Yeah.
Now what that means is that you tend to get an irregular heart rate
Right.
with it. Okay? And that's what we found in you.
Okay.
Does that make sense to you?
And is that why we're feeling tired?
It may have an impact on why you've been feeling tired. Obviously,
Okay.
you mentioned also that you think it was something to do with old age.
Well, yes. I've had my 3 school years and 10. And,
Is anyone at home with you? Are
yes,
you-
my wife. Yes, she's a bit younger than me, though. She's
Right.
still
So does she
Spike
look
of
after
being
you,
in
or
the
do you
70s.
look after her?
Oh, a bit of both.
Okay.
Yeah.
So, does that explanation of what that is make sense to you?
Yes. Why does it go wrong though? What's the
So
problem?
it can be because of strain on the heart over a long period of time.
Right.
So with the fact that you've had high blood pressure for a long time, that puts a bit of extra strain on the heart over a long period,
Yes.
and that might be part of why it's happened. As I said, it's very common.
Yeah.
Now, I've asked you about some of the symptoms you get with atrial fibrillation, and you don't, you know, from the sounds of it, you're not getting any symptoms.
Right.
And sometimes it can cause you to become a bit, to get flutters in your heart,
I haven't
like
found anything.
palpitations. Now, there is, however, because the heart isn't beating normally as it should do, you can get blood clots forming. And that's the thing that we worry about with this funny heart condition. You know?
Right.
And that's something that we would normally suggest putting you on some medication
Okay.
to treat you, to try and prevent the risk of basically you having a stroke in the future.
Right. Yeah.
Does that sound worrying to you?
Well, I wouldn't want a stroke, you know. No. Okay. So what kind of treatment do you give?
Okay, so are you on any other medication other than the ones
On the
that
stuff
you
for my blood
just on the
pressure.
stuff for your blood pressure? Okay. And are you coping all right at home?
Yes. Yes. Yeah.
Good. And is your wife well?
Yeah, she's fine. As I say, she's happy than me, so she's a spring chicken, she's fine.
Okay, good. What I'd like to do, if it's all right with you, is just quickly examine you,
Okay.
and then we'll move on to what we can do to treat this in the future, and what medications we might start you on.
Right, so what are you looking for then?
I'd just like to have another feel of your pulse,
Yeah.
check the blood pressure
Yeah.
now, and do those really, and have a listen to your heart as well.
Right.
And I'd also like to have a listen to your chest.
Okay.
Okay?
Okay, the heart sounds are normal, the pulse rate is 94, the blood pressure is 118/84.
Okay. And sorry, just one other question. You're not struggling with shortness of breath at all?
I haven't noticed. I think your breath does get short as you get older. So it's normal for me.
Well, that is true, yeah.
Yeah.
And do you smoke at all? No. And do you have diabetes?
No, I don't think so. No.
Okay. And is there any family history of heart disease at all?
No, I don't think so.
Okay.
No.
Fine. So in terms of treating this irregular heartbeat,
Yes.
there's a couple of treatments really. One of them, as I said, is because of this irregular heartbeat, you have an increased risk of stroke. Okay. Now, what we would therefore suggest that you go on one option for treatment is something called warfarin.
I've got some buddies on that down
Have
the
you?
region. Yes, they're on warfarin.
Would
You
you,
have to go for a blood test every week.
well,
Yeah.
what do you think about that?
They look at it as a day out, you know. To enjoy
Can
it.
be.
I'll probably
See
meet
some
them
friends.
down there, yes, if it's local, yeah, I'll probably meet them down the clinic.
Yeah. Well, it's a treatment that when you start on it, it
Yes.
can take a little bit of time to get the dose right for you,
Right.
because everybody's different and different people need a different amount of the dose to get the blood test right in there.
Okay.
So normally at the beginning, you have to come and see one of the nurses to do a blood test quite often,
Okay.
say every few days, but as you become stabilised on it, in the longer term, hopefully you'll only need to come once a month for a bit and then, you know, a couple of times a month after that.
What does this warfarin actually do?
So what it does, as I said before, because this heart's got going into a funny beat, it's not pumping as it should normally do,
Yes.
the blood tends to sit around a little bit more and then you can get clots.
Right.
So the blood gets sticky and it
Yeah.
clots.
Yes.
And then the heart can throw that clot off and cause a brain stroke, which is a clot in the brain. But if you're on the warfarin, that thins the blood to reduce that risk. And we know that it reduces the risk a lot.
Okay.
The treatment that people used to be on was aspirin. Have you heard of that?
Yes.
So lots of people are on aspirin, and that thins the blood as well.
Okay.
But all the evidence really shows that warfarin is better.
Okay.
There are some things you have to be careful about with warfarin because of the blood's thinner, it can make you bleed a bit easier. So you might bruise a bit easier, and we do have to keep an eye on that.
Right. Okay. That's interesting.
How do you feel about that?